Hello, I'm Dr. Baby, and I'm here to tell you one of my favorite jokes. It was on a shortcut through the hospital cafeteria that Albert was first approached by a member of the antibiotic gang. Hey, kid, want to be a superbug? Stick some of this in your genome. Even penicillin won't be able to harm you, eh? Ho, ho, ho. This reminds me of my drug-dealing people. Goodbye, everybody.
He's just kidding. That's his pharmacist grandfather that he's talking about. He's not an actual drug dealer. So as Dr. Baby was telling you the joke about bacteria, today I'm here to talk about vancomycin-resistant enterococci. VRE, as it stands for, is a very serious disease, as a very serious bacterial infection, and as you can see, it's pretty high on the scale. There's 20,000 drug-resistant enterococcus infections a year. There's 1,300 deaths per year and 66,000 enterococci infections per year. And it's only experimentally treated, so there are not very many options as to the treatment for this. Introduction. Enterococci are bacteria that are ascendant from nosocomial pathogens. The second most common organism taken from nosocomial urinary tract and wound infections. So for the most part, these are found in the urinary tract and in open wounds, specifically from catheters and surgeries. And it is the most common cause of nosocomial bacteremia in the United States. Their ability to mutate or receive foreign genetic material through transfer of plasmids and transpons enables them to acquire resistance to all antibiotics. And so the mechanism of how it works is the VRE changes its cell wall to a different shape than what vancomycin is. Vancomycin is a type of antibiotic, and it changes the shape so that the vancomycin cannot enter into the cell. It can exist in the female genital tract, and it can stay there without causing disease. That's also referred to as colonization. And the multi-drug resistant enterococci are they're resistant to penicillin, amyloglycosides, and glycopeptides, and they're treated experimentally, which means there is no specific cure for them. It's just a trial and error sort of treatment. Diagnosis. This condition is diagnosed through blood tests, samples of bowel movement, urine, or wound debris, which if you were doing wound care, you would take some of the debris in for testing to see if it had any VRE in it. The signs and symptoms of VRE, which are very important for PT or PTA to know, so that you would know to tell a nurse or a doctor that you are suspecting that there may be a VRE infection. And these signs are fever, chills, body aches, weakness, and dizziness, urinating more often than usual, pain when urinating, urine that smells bad, or blood in urine. Blood in urine can also mean a UTI, but specifically here, it might also be a VRE. Pain or pressure in abdomen, and red and warm skin around a wound, or soreness, swelling, and drainage from a wound. So basically, if a wound is looking unusual, smells bad, if you're noticing weird smells and weird drainage, it's a good idea to let someone know. The groups that are affected by VRE, specifically and most commonly, are people who are hospitalized for a very long period of time. People who are over 55 years old, receiving antibiotic treatment. People who have had vancomycin treatment in the past tend to have a resistance to it. That's why they try and not use as much antibiotics as they used to in the past to not create as many antibiotic resistant bacteria. People with weakened immune system, those who are in long stays in ICU, specifically those who have intravenous or urinary catheters that stay in a person for a long time, they can develop a VRE infection. And people in transplant and cancer wards and those who have undergone major surgeries, usually because they have open wounds and because they have been under anesthesia for a long time, they are immobile. So these specific cases are actually the most likely to die from a VRE infection, and that would be the people with neutropenia, chronic renal failure, and those that have received a liver transplant. Those people are the most weakened by their conditions and are most likely to die from a VRE infection. A patient who has VRE is going to be quarantined to their room. The hospital, it's called a plague on hospitals everywhere, so they try their best to keep those patients contained and away from the other patient population. So some of their physical impairments might be general weakness, fever, dizziness, pain in abdomen, urinating more frequently, and unusual wound presentation. How physical therapy would be most likely directly involved with a VRE infection is wound care, and that's if that's what the PT or PTA was assigned to do. Wound care, you may be working on strengthening, range of motion, or gait, because these people do tend to be stuck in their hospital bed for a while. Implication. This is the most important thing for any PT or PTA to know, is to wash your hands. That's why it's capital letters. It's very important. The number one way that VRE infections are spread throughout a hospital is through a medical provider not washing their hands after they have come in contact with someone infected with VRE. So it's very important. You need to wear a gown and gloves before entering, change gloves while you're cleaning. If you're doing wound debridement, you should change your gloves periodically just to keep the infection from spreading. Clean all the equipment the patient uses. It's best to designate equipment specifically for that patient if possible. And after you finish with the patient, wash specifically with antiseptic soap, because regular soap will not kill a VRE infection. Specific physical therapy interventions, most importantly, would be patient and family, as well as sometimes nurse and staff education, because the patient may be in the hospital for a long time and they're at a risk for ulcers because they do not move. And so you need to educate them on patient comfort and bed mobility and patient ability to move as much as they can so they don't develop ulcers. And therapeutic exercise, if it might be just simple range of motion exercise. If the person can't get up that day, they're usually very weak and may not be able to do gait training. In closing, it is all about the recovery, and physical therapy is most importantly a good way for a patient to feel productive, to feel like they are not sitting around and waiting for something to happen. And it's about positivity. You're teaching your patient to get through whatever they're going through. If it's a VRE infection, they may be weak, but they can still do bed training, they can do ankle pumps, any kind of small activity just to keep them moving. Thank you very much for watching. Bye.